The appointment was at 9:15, my 7th appointment in 2 years. Same office, same posters on the wall about hand washing and flu vaccines, same paper cover on the examination table that crinkled when I sat down, same doctor, Dr. Renee Walsh, who had been my primary care physician for 4 years and who had a reputation for thoroughness that I had believed in until the thoroughness had stopped applying to me. She came in at 9:22. She looked at her tablet. She looked at me. Dr. Walsh said, "Still having the fatigue?" I said, "Yes, and the joint pain, and the brain fog, and the hair loss that started in month 4. She typed something. She said, "Your blood work from last month was normal. Your thyroid panel was normal. Your CBC was normal." I said, "I know what the results said. I am telling you that something is wrong. I have been telling you that something is wrong for 2 years. She looked at me over her tablet with the expression I had come to recognize. Not unkind, not dismissive in an obvious way. The specific expression of a doctor who has decided what a patient's problem is and is waiting for the patient to accept that conclusion. She said, "Sarah, I think we need to talk about anxiety management. Chronic stress can produce all of the symptoms you're describing. I'd like to refer you to a therapist." I had been referred to a therapist 8 months earlier. The therapist had been helpful. The therapist had also said, after 3 months, that my physical symptoms were beyond the scope of what therapy alone could address, and that I should push my doctor harder for a specialist referral. I said, "I would like a referral to a rheumatologist." Dr. Walsh said, "I don't think that's necessary at this stage." I said, "I have been asking for a specialist referral for 14 months. I am asking again." She said, "Let's give the anxiety management approach a few more months and see how you respond." I looked at the poster on the wall about hand washing. I looked at the paper cover on the examination table. I looked at Dr. Walsh. I said, "Thank you for your time." I picked up my bag. I walked out of the office. I did not book a follow-up. I called a different doctor before I reached my car. My name is Sarah Novak. I am 33 years old. I am a high school English teacher. I have been one for 8 years. The job requires a specific kind of sustained energy, not athletic, not physical, but the particular mental and emotional stamina of someone who is responsible for 32 teenagers for 6 hours a day and who needs to be fully present for all of it. I had been fully present for most of my career. Then, gradually, and without a single dramatic moment, I had started to not be. The fatigue started in month 1 of what would become a 2-year diagnostic process. Not the tired at the end of the day that everyone feels, the tired in the morning before anything has happened tired, the tired after sleeping 9 hours tired, the tired that does not respond to coffee or sleep or rest tired. I had gone to Dr. Walsh because that was who you went to when something was wrong. She had ordered blood work. The blood work had been normal. She had said, "Sometimes our bodies go through periods of adjustment. Let's monitor it." I had monitored it. Over 24 months, the fatigue had been joined by joint pain, primarily in my hands and knees, worse in the mornings, by a specific kind of mental fog that made word retrieval difficult in a way that was frightening for an English teacher, by hair loss, not dramatic, not visible in a way that alarmed other people, but visible to me every morning in the shower drain. I had brought each symptom to Dr. Walsh as it arrived. Each time, normal blood work. Each time, anxiety, stress, the need for better sleep hygiene, the possibility of therapy. Each time I had left feeling like a person whose experience of their own body had been overruled by a normal result on a standard panel. I want to be precise about what that feels like, because I think it is important. It does not feel like being dismissed. It feels like being managed. The doctor is not saying your symptoms are not real. The doctor is saying the symptoms have an explanation, and the explanation is something internal. Stress, anxiety, the mind producing what the body then expresses. And because the explanation is inside you, the solution is also inside you. Try harder. Manage better. Accept that this is what your life is now. I had spent 24 months trying to accept that this was what my life was now. I had not accepted it. The second doctor's name was Dr. Michael Chen. He worked at an integrative medicine practice in Columbus that I had found through a colleague who had mentioned him in a faculty meeting context I had only half heard and had written down anyway. He was not covered by my insurance. The appointment cost $340 out of pocket. I had booked it the morning I walked out of Dr. Walsh's office. His intake process was different from the first moment, not dramatically, in the specific way that a conversation feels different when the person listening is genuinely building a picture rather than confirming one they already have. He asked me to walk him through the symptoms in the order they had appeared, not the order I usually listed them, the chronological order starting from the first symptom I had noticed. I talked for 18 minutes without interruption. He took notes, physical notes, on paper, which I had not expected. When I finished, he said, "Sarah, I want to ask you some questions about things you haven't mentioned yet." He asked about sun sensitivity, about mouth sores, about a specific kind of rash I had dismissed as dry skin 2 winters ago, about whether the joint pain moved or stayed in the same places. I answered all of them. He was quiet for a moment after the last answer. Dr. Chen said, "I'd like to run some blood work, not the standard panel, some specific markers that aren't included in a routine CBC or metabolic panel. I want your ANA, your anti-dsDNA, your complement levels, and a few other things. Can you go to the lab today?" I said, "What are you looking for?" He said, "I want to see if there's evidence of an autoimmune process. What you've described, the pattern, the progression, the specific combination of symptoms, is consistent with several autoimmune conditions. I don't want to name one before I have the results, but I want these numbers before your next appointment." I said, "My previous doctor ran blood work multiple times." Dr. Chen said, "Standard panels don't include autoimmune markers unless a physician specifically orders them. I'm ordering specific markers." I went to the lab that afternoon. 3 days later, Dr. Chen called me. He called on a Wednesday morning at 8:47. I was in my classroom before first period, grading papers I should have graded the night before, but had not had the energy to finish. Dr. Chen said, "Sarah, I have your results. Do you have a few minutes?" I set down my pen. He said, "Your ANA came back strongly positive. Your anti-dsDNA is elevated. Your complement levels are low. Combined with the clinical picture you described, the joint pain, the fatigue pattern, the hair loss, the photosensitivity you mentioned, the history you gave me, I believe you have lupus." I said, "Lupus?" He said, "Systemic lupus erythematosus, an autoimmune condition where the immune system attacks the body's own tissues. It is chronic and manageable. It requires a rheumatologist for ongoing care. I am going to refer you to a colleague today. But Sarah, I want you to know something." I said, "What?" He said, "The markers I found today were almost certainly present during the blood work your previous physician ordered. The ANA in particular would have been detectable with a standard autoimmune panel. It was not tested because it was not ordered." I sat with that. The markers were almost certainly present. 2 years of normal blood work. Not because the condition was not there, because the specific tests that would have found it had not been ordered. I said, "What do I do now?" He said, "I'll send the referral to rheumatology today. In the meantime, and I say this gently, you might want to have a conversation with your previous physician about what you found." I said, "Yes." I was already thinking about it. If you have ever been told the problem was inside your head when the problem was inside your body, you already know why this story exists. Subscribe and hit the bell. New story every day. I booked the appointment with Dr. Walsh for the following week, not in anger, not to humiliate her, because I needed to close something and because I believed, and I still believe, that a physician who has missed something significant for 2 years should know they missed it. My rheumatologist, a woman named Dr. Park, who I had seen the previous Thursday, had been clear about the timeline. "Doctor, Park said, "The ANA and anti-dsDNA elevations you showed are not subtle. A positive ANA at this level would have been detectable at any point in the past 2 years if it had been tested. The markers are consistent with active disease, not a recent onset." I said, "It was present the whole time." Dr. Park said, "Almost certainly. The standard approach for a patient presenting with fatigue, joint pain, and multiple systemic symptoms of unclear origin should include autoimmune screening. It is a routine addition to a diagnostic workup." I had brought this documentation to the appointment with Dr. Walsh, Dr. Park's initial assessment, the specific test results, the referral letter. Dr. Walsh's waiting room was the same, the posters, the hand-washing instructions, the crinkle of the paper cover when I sat down. She came in at 9:19. She looked at her tablet. She said, "Sarah, I see you're here for a follow-up. What's going on?" I said, "I have something I want to share with you." I placed Dr. Park's assessment on the examination table between us. Dr. Walsh picked it up. She read. Her face did not change dramatically. She was a professional, and professionals are trained to receive information without visible reaction. But her hands stilled on the paper in a specific way. She read it twice. Then she set it down. Dr. Walsh said, "I see. When was this assessment completed?" I said, "Last Thursday." The blood work that identified it was ordered by a second physician I saw the week before, after our appointment. She said, "I see." I said, "Dr. Walsh, I want to ask you something, and I want an honest answer." She looked at me. I said, "Is ANA screening something you would typically order for a patient presenting with my symptom profile?" A pause. She said, "It is something I should have considered more thoroughly, yes." I said, "I came to you 23 times in 2 years. I described these symptoms at every visit. I asked for a specialist referral 14 months ago and was told it wasn't necessary." She said, "I understand." I said, "I am not here to file a complaint. I am here because I needed you to know what 2 years of being told this was anxiety actually produced. I have a chronic autoimmune condition that was present the entire time and that I am now managing from a 2-year deficit of appropriate treatment." Dr. Walsh said, "I hear you, and I am sorry." I sat with that for a moment. It was a real apology. Not managed, not defensive. Real. I said, "Thank you." I said, "I hope you will order autoimmune screening earlier for other patients who come to you with this kind of presentation." She said, "I will." I picked up the assessment from the table. I put it back in my folder. I stood up. I said, "I won't be continuing as your patient. I wanted to tell you that in person." She nodded. I left. If this moment stayed with you, leave me a comment. Have you ever been told the problem was in your head and found out later it was in your body the whole time? Tell me how long it took and who finally listened. I read every single one. I have been treating lupus with Dr. Park for 7 months. The treatment is not simple. Lupus is a chronic condition, and management is ongoing, and the disease has periods of activity and periods of relative quiet, and the work of understanding how my specific body expresses it is a project that will continue for the rest of my life. What I want to tell you about the 7 months is not the treatment protocol. It is what the treatment felt like after 2 years of no treatment. The fatigue did not disappear immediately. The joint pain did not vanish. Autoimmune conditions are managed, not cured, and anyone who tells you otherwise is describing a different disease than the one I have. But 3 weeks into treatment, I woke up one morning and I was tired in the normal way, the way that responds to coffee, the way that lifts by mid-morning, the way that is the baseline of an ordinary day rather than the ceiling of a managed one. I sat in my car before school and I cried for 7 minutes. Not because I was sad, because I had forgotten what ordinary tired felt like, and it had come back and I recognized it, and I had not known how. Much I had missed it until it returned. I am teaching full periods again. I am grading in the evenings. I am present in the specific, sustained way that the job requires, and that I had been losing, slowly and then faster, across 2 years of being told the problem was in my head. The brain fog has lifted enough that word retrieval is no longer frightening. My hair loss has slowed. The morning joint pain is manageable on most days. These are not dramatic outcomes. They are the ordinary functioning of a person whose condition is being treated. After 2 years of being told there was no condition, ordinary functioning feels extraordinary. I filed a formal concern with the medical board 3 months after my appointment with Dr. Walsh. Not a malpractice claim, a formal notation of a clinical pattern that I believed warranted review. The board's response was administrative and did not result in any action I was informed of. I did not file the concern for an outcome. I filed it because the record should exist. Because if another patient presents to Dr. Walsh with a 2-year pattern of systemic symptoms and receives 23 months of anxiety referrals, I wanted that concern to be in a file somewhere. The record matters, even when it does not produce a visible consequence. I am 33 years old, and I spent 2 years being told that a real physical condition was anxiety because my doctor did not order the specific blood tests that would have identified it. The first thing, you are the expert on your own body. This sounds simple. It is not. Sitting in a medical office across from someone with a medical degree and a tablet full of normal results and being told that what you are experiencing has a psychological explanation, that is a specific kind of disorientation. It makes you doubt your own perception. It makes you wonder whether you are the kind of person who invents illness. It makes you spend months trying to manage something internally that requires external treatment. You are not the kind of person who invents illness. You know your body. You know what baseline feels like, and you know when you have departed from it. That knowledge is real, and it is valid, and it does not require a doctor's confirmation to be true. Trust what you know about your own body. The second thing, normal blood work is only as useful as what was tested. My blood work was normal 23 times, because the specific markers that would have identified my condition were never ordered. A CBC and a metabolic panel will not find an autoimmune condition. An ANA and anti-dsDNA panel will. If you have been told your blood work is normal and you continue to feel that something is wrong, ask specifically what was tested. Ask whether autoimmune markers were included. Ask what the differential diagnosis includes for your specific symptom combination. Ask the questions that move the conversation from, "I feel bad," to, "What specifically might cause this combination of symptoms in a person my age?" A doctor who cannot answer those questions specifically is a doctor who has not yet done the specific work your case requires. The third thing is about the second opinion and what it cost. $340, out of pocket. No insurance coverage, an amount that was genuinely difficult for me to spend in the month I spent it. That $340 purchased the diagnosis I had been trying to get for 2 years through 23 covered appointments. I am not going to tell you that spending money you may not have on a second opinion is always the right choice. I am going to tell you that if you have been in a medical system for a significant period of time and have not received answers that match what you are experiencing, a second opinion is the most important investment you can make. Not because the second doctor is always right, because the second doctor is looking at you fresh, without the accumulated assumption that the first doctor has built over years, without the chart note from month 3 that said anxiety and that colors every subsequent appointment. A fresh set of eyes and a fresh order sheet, $340. 2 years versus 3 days. I do not think about what the 2 years cost me very often anymore. I am trying to look forward rather than back. But sometimes in the morning when I wake up and the tired is the ordinary kind, the kind that lifts, I think about month 7 of the 2 years. When I was at my lowest and I had just been told again that it was stress, and I had sat in my car in the parking lot and wondered if I was going crazy. I was not going crazy. I was sick, and I needed someone to look for the right thing. Hi everyone, thank you for being here. Tell me in the comments, have you ever known something was wrong with your body and been told it was in your head? How long did it take before someone listened? I read every single one. If this story reached you today, subscribe. New story every day. Sarah Novak, Columbus, Ohio.